Transplant House is a wonderful thing to do when patients and their families come for a transplant. It often takes a while for the test to be done and preparations to be organized and for the patient to be ready for surgery, and then of course after surgery there's a period of recuperation, and during this time it's really important that their families are around and can help out and see how they're doing and give them encouragement. It just creates a kind of very positive atmosphere that we're proud of.
Transplant House is going to be a wonderful thing for our patients and their families, because if they came from a great distance, which about a third of our families do, this will allow the patients, if they're well enough to be taken care of outside the hospital, and their families to come and stay in our transplant house for as long as they need to be that close to the hospital.
About 4 years ago, Dr. Shaked, who's the director of the Transplant Institute, decided that we really needed to pool our resources, get some patients involved, and we're very lucky tonight to be here in this beautiful building, about to build another one.
The families that we meet in our department, it's amazing, because they stay over in hotels and family house, friends, and this way they can be together and closer, to their families while they're here waiting for transplants or after the transplants.
The Transplant House is particularly important to me because my donor was from the Pacific Northwest, and my aunt was very generous in giving money for both my aunt and my sister to stay in a hotel. So the Transplant House would be the kind of place that they would have been able to stay, and was not available to them at the time. So I think the families that have this opportunity are extremely fortunate.
Having the Transplant House will have their family readily available for all the emotional ups and downs that every transplant patient goes through. And having them very close by will mean a world of difference to everybody involved.
What we'll have with the Transplant House is 12 people in different stages of transplantation, all able to help each other. Plus, there'll be another 12 people, because every person that gets a transplant has a support person that is also going to be able to learn and help each other.
So by having a house, we can actually center ourselves in one place, a place for support groups, a place for people to share their stories, and so we're really looking forward to it.
The notion that you can provide an environment that it is welcoming, and where nurses and doctors could have conversations and lectures, and the ability to explain in a much generic way the procedures to people. It seems to me that that could be wonderful.
I read about this a long time ago, and it's very nice that it's now going to be started.
Patients' families have needed this for ages, and finally it's going to happen.
And we've worked a long time to get this house going, and it's a very exciting night.
It's just pure excitement and joy just to see this finally coming together. It's the very beginning, I should say, of actually starting to get everything underway.
This is a great gift for us to be able to share with Penn Medicine and the whole community. We're just so proud to be able to do the groundbreaking tonight, and we look forward to it opening in a year and a half from now.
This is very exciting, and the truth is it's not just for us, physicians or healthcare givers or something like that. It's really for you, the community, and whoever is there watching it, knowing that you can come to us, and we can not only just do the surgery or make you feel better, but you have always a place to stay. Isn't it nice?
It's a gift. It's a gift.
It's a breakthrough.
Fantastic.
Excellent. Miraculous.
Wonderful.
Magnificent.
It's a beautiful example of the human spirit at work.
Go Transplant House!